My name is Debbie Biggs, and I work in the radiology department. I'm an office manager, and I've been here 25 years.
My name's Frances Curtis. I have been here a little over 5 years, and I work in radiology.
My name is Susan Barlow. I work in radiology at Blue Ridge Radiology on Parker Road. I've worked there for 15 years, and I worked at Grace for 9. I do the nuclear medicine, x-ray, and mammography.
And I'm Lisa McNeely. I work at Blue Ridge Radiology and Scheduling, and I've been there a little over 5 years. We're breast cancer survivors.
I just finished my last chemo treatment on September 21st, so I'm new. I had breast cancer into March this year, and I went and had my physical, and my doctor found the lump then, and then I just started from there and had to have biopsies, and then I elected to have a mastectomy, and from there I had like a recovery time for like 6 weeks before I started chemo. I've had 8 treatments of chemo, and I've just finished my last chemo. So that's where we are now.
Yay!
Yeah,
Good for you.
I went for my regular mammogram, and I had skipped the year before, just saying, well, it doesn't really matter anyway. And when I had my mammogram, they found something. And so they did more images, and then I had an ultrasound, and I had small cell. I had in situ. It's the small cells scattered throughout my breast. And I would have never felt it. It would have never shown anyway. If I hadn't had my mammogram, I probably wouldn't be here today. But I had elected to have a right mastectomy, and then I went through 6 months of chemotherapy. And last week was my 5-year checkup, and I am cancer-free, and I'm doing wonderful.
Congratulations! Yay!
I'm 7 years out. My cancer was not as aggressive as the ladies that's with me here. I did have a pre-cancer in '94, and I had a portion of that breast removed on the right. Exactly 1 year later, I had the cancer on the left side, and so it was scattered throughout my breast, and the surgeon suggested that I have bilateral mastectomy and total reconstruction and have my lymph nodes checked, which I did, and my lymph nodes were clear, so I was very fortunate. I didn't have to go through chemo or the radiation, and so since then, everything's been great.
And here you are today.
I'm here.
And we're glad. Yeah. I am 10 years out as of January of 2012, so I'm very thankful. I actually found my spot on my own as I was dressing one morning. And so I had my mammogram, and I was actually coming up on my mammogram in 10 days anyway. So I had always had yearly mammograms. So I waited the 10 days and came and had the mammogram, and I remember the doctor calling me into his office, and he looked at me and he said, "Lisa, these have got to come out," because it was more than one spot. So we got on the road and had the mastectomy done and had chemo, and had four rounds of chemo. Debbie, I hear you had 8 rounds,
yes.
So I empathize with you. But it worked out well, and here I am today, and I'm very thankful.
Scared. Yeah, it's scary. It breaks your heart. You're like, me? Why me? I have a large family, lots of women. Not a single one had ever had any sign of breast cancer.
Yeah. I agree, Frances. I didn't have a family history at all either, and you do wonder. But I guess I just went into action gear, and what's next?
Yeah,
What's
that's
next?
what I said. I was like, okay.
Yeah.
But then it made me mad. I was like, okay, this ain't happening. I have a
I'm
family to
gonna do
raise.
this.
I've got things to do. I don't have time for cancer. I'm going to fight this.
Yeah.
What do we do next?
Yeah.
Yeah, I just we have to tackle it. I can't let this take over.
I think us working in radiology and working with women all the time and mammograms, we know how important it is. Mm-hmm. And when I found out, I thought, not me. It's the other women, not me.
Right.
And I was scared, but I tried to be strong because I didn't want my
Your
husband or
husband,
children.
family.
Yeah.
Right.
Yeah, so I was strong because I felt like we had more, us being in radiology, we have more education about it, and we know there's, a survival, you survive cancer, you can do it. And I felt like, so I was strong for them. But it was scary, and this lady right here was wonderful because she, we worked together, and her just coming on 5 years, she took me to the side and showed me her mastectomy, and every time I had anything, she said, this will be next, this will be next, and she's helped me a lot.
She was your guide.
Right. She's my little angel.
Well, I had a friend that did that for me, and I knew how much it helped me get through the process. So it does help. So I thought, well, if there's anything I can tell you to do for you, I was glad to do it.
And only talk to the people that are positive. Never talk to
right.
anybody negative. Because it's just not the thing to do. It's just
And a positive spirit and state of mind is very important.
right.
Yeah, it is.
It is.
And we have a wonderful work family. I mean, I've had so much support in our department. Down to the administration, down to housekeeping. I know so many people working here so long, and then I've had so much support. Hugs every day, and
Well, I know
prayers
we
and
work
cards
in
and
separate buildings.
Yeah.
And how many times a day, did Cosette or someone
we
say,
got-
"Gosh, I wonder how Debbie's
reports.
doing." Yeah. So we got reports on you.
yeah. I've got hundreds of cards from people and just so much support. And that's,
I
that's what
saved
keeps
all
you
of mine.
positive.
Yeah.
I know Rhett was 7 years old, and that was scary for me because I had him when I was close to 40, and I had a scare the year before, when they did the biopsy on the right side, and then I got my results, and it was just a precancerous sort of thing. The doctor told me at that time, he said, "You're looking at a long road of this, so you have dense breast tissue and lots of things in there." And the doctor told me right up front, he said, "You're looking at a very long road of biopsies, and you're going to be checked probably every 6 months." And I'm thinking, to do that for the rest of my life, is and then meeting deductibles, it's a financial burden too.
Yes.
That set the stage. And then if the next year, finding out, when I actually heard the second round and it being cancer, it wasn't as big of a shock because I had already gone through the initial shock of having to have the big biopsy and having half the breast removed and that sort of thing. So the actual diagnosis of cancer wasn't as scary for me. I was shocked to find out that I was going to lose both of my breasts at one time, and then the lymph nodes, waiting for reports, from that, waking up from surgery, not knowing what you were going to hear next, that sort of thing is really scary. Facing the mirror and seeing, everything's removed, and, but I think you find that you're a lot stronger than, you've got a lot more strength than what you ever dreamed of. Yeah. With a family, elderly mother, little child, husband, and the husbands go through a lot too.
Yeah.
So it involves a large amount of people,
Group of people.
everybody that knows you.
I know when I went to the hairdresser to have my hair cut because I was losing my hair, I decided just to go ahead and have it cut. It hurt him worse than it did me because I kept telling him it'll grow back, and it does.
Yeah.
But you're exactly right.
You're so
it affects
strong.
many people, not just you and not just your immediate family, but it affects your circle of friends.
It does, and everybody, and people see that it can happen to anybody. I had a friend. She hadn't had a mammogram. She's in her 40s, and she took care of my son after school, and she just went. As soon as I found out, and I had told her, she was shocked, and she said, "I'm going to go get my mammogram," and she did, and she had a cancer. That was her first mammogram.
What about that?
So she's doing great.
Good.
She's
good.
doing great, and so it does save lives.
It sure does.
You know,
Early detection.
It's the best
It does
protection.
save
That's
lives.
right.
Every year, or whenever your physician recommends it. But I know I'm every year.
Yeah.
You know, and I don't let it go by. I don't let
Yeah.
too many days go by from the last one.
And I think your physical is just as important, because I had my mammogram in December and had my physical in March. If I hadn't went on and had my
That's right.
physical, she wouldn't have found it.
That's right.
Because I'm not one to do self exams, but I start. The one I got left, then we'll start.
It won't be as hard then.
Right. But early detection is the best protection.
That's right.
Yeah.
Keep your mammograms and your physicals.
Catch it soon and you'll survive.
Yeah.
Okay.
Yeah.
a lot of ladies that come in that I talk to, they find something, and there's an intuition sometimes with that, and they'll find something and it bothers them, and they'll go to their doctor, and then it is, I've seen it so many times. I've got a feeling about this spot here.
Yeah.
And that's important too. I think women have that intuition. They know that something's not quite right.
Better to have a mammogram or a couple of extra pictures and it be nothing than miss something that is.
Because things can pop up really fast.
That's right.
Yeah.
That's right. We're glad we're here though.
Yeah.
Well, I know being 10 years out, I've been able to, experience my children graduating from high school, from college, grad school, getting jobs, my daughter's wedding, and our first grandchild this year.
Oh, wow.
I was
That's
thinking about
wonderful.
that this morning.
Yeah. So it's been a special 10 years.
Do you mind me asking how old you were when you got breast cancer?
I was 44.
44.
Yeah. So people think, that they have to be in their 50s or 60s or,
You were 45? And I'm 49 this year, so
Right,
it's like
right.
when you hit 50, you fall apart.
but they can put you back together.
Right. Yeah.
47.
You're 47, so we were all young. I mean,
Exactly.
Yeah.
Exactly. With young children.
And we're seeing
Yeah,
more and more
so-
young people,
Absolutely.
Right.
That's right.
30s.
Yes.
So it's, wow.
And, a lot of patients don't realize that insurance covers that screening. Most insurances will cover a screening. And so when you come in to have your mammogram, generally there's nothing paid that day. We file your insurance, come have it. That's the most important part, is come get a mammogram.
And we have a wonderful foundation, the Coleman's Foundation, that
That's right.
that if you don't have insurance, that
That's right.
helps pay for it,
Right.
and so it helps.
Yeah.
But me, I'm just 6 months out, from having breast cancer, and it's been hard because it's just like it's took my whole summer away, and it takes so much, because I've always been a real active person, and just always going and working, and I'm the one to work 10 hours a day and stay there late, and it's just, I go home and pass out. But
It does tire
it
you.
takes a lot away from me. When I found out when I had cancer and I had the mastectomy at 6 weeks home, that was a nice 6 weeks vacation. I thought it was nice, just being home at 6 weeks. And in the meantime, my daughter got married during at 6 weeks, and my son's in the Navy, so we got to visit and stuff. I just think it's been hard. And I think without the support of family and friends and church, I couldn't have made it. And God gave you cancer for a reason, and I'd much rather for me to have it than like my mom or somebody that couldn't.
Right, exactly.
They couldn't.
Might could have found it.
Yeah,
That's right.
they
Be strong
couldn't
enough
go
to
through
fight
these
it.
treatments.
Yeah.
And then my husband and family, they've been right there with me. Scott was at every appointment and every chemo treatment, and held my head while I puked.
That's important. Somebody to hold your hair back.
Having that
while you
support
have
really,
hair.
really helps.
Right. And I feel I'm a stronger person. I've always been a strong person, a strong
yes,
faith.
you have
But
been.
if I can help one person by telling my experience, then maybe someday that like Francis helped me through this so much, and then talking to you on the phone one day, then you talked and talked, and I hope someday I can help somebody.
Right.
And I think one thing that's very important is keeping a sense of humor throughout the whole event, because I know that my chemo lasted till May or June, and so we had the beach trips in the summer, and of course I didn't have hair. And so it was so nice to be able to step out of the shower and just, dust off up here and, hit the beach. So that's a little bit of, humor. I was a bald lady, but, it felt really good not having to do the hair.
Right. I went all summer, didn't have to shave.
Well, it's me in summer. I mean, I have no hair under. It's just a wig.
That's right.
Summer.
And
So
it's been
It
nice.
feels pretty good.
Yeah.
Yeah.
Yeah, so you have to look at the good spots.
That's right.
What you get.
Keep a positive
my
attitude.
face was baby smooth.
I know.
It's like,
No leg hair. It's been wonderful.
it was terrific. Yeah.
That's right.
But,
Got to look on the positive side.
Yeah.
I was like you. Whenever I started losing my hair, I went and had my beautician cut it off.
Right.
And then that night, my husband and I, he shaved my headrest off and he shaved his head. We took pictures of us.
Oh, that's
How
yeah.
nice.
That's good.
So
My husband probably wouldn't shave his head. He probably wouldn't. He would probably think it wouldn't come back.
he was worried about head anyhow. Didn't matter.
Oh, gosh.
Well, we're sitting here, 6 months and
Yeah,
5 years, 7 years, 10 years. So, have a mammogram because that can happen.
Right.
So,
But I do
Yeah.
appreciate it day now. I get out of the car in the parking lot
Yeah.
and walk in and I look up every day.
I believe I do too.
I'm like,
Me too.
Lord,
You're
thank you
right.
for this beautiful day, even if it's
If it's
cloudy.
raining. That's
if it's
right.
raining.
Yeah.
Rain's going to feed the earth,
Yep.
I'm like, it's another beautiful day and
Yeah.
I'm here.
Yeah.
And I never wanted to work in healthcare. Never had any desire to. But while I worked in banking, and while I was out having my treatments, my bank let my position go. So we had no money at one time. There for about 4 months, we had no income other than my husband's. But we had friends, cousins, just send a check in the mail. So we thought you just might need this. We never missed a payment on anything.
Wow. Good for you.
Everything was provided for. And so once I knew I was through treatments, I'm like, okay, I got to get back to work. I got to get back to routine. Things got to pick back up, go back to normal. And I believe it's all over. I mean, I've beat this. I fought it and I've won, and I've got to get back to normal. And I thought, well, where's the best place to start looking for a job? And I was treated so well by my doctors and the nurses and everything I went through. So I thought, I'm just going to look at the hospital around, see if I can find a position. And ended up being hired for the radiology department,
Right.
where I check in people every day that are having a test that might tell them they have cancer sometimes.
Come full circle, haven't you?
And I can relate to them. I said, I understand what you're going through. You get this study done, get the results to your doctor, and they'll take care of you. It's a good way to get this test done, and you can empathize with
Right.
people, and they realize it. And I'm hoping,
Yeah.
I feel like I'm in a position now that I can help other people just by being able to share my experience with them. And it makes me a whole lot more empathetic to their
Absolutely.
situations.
You bet.
You can be tired, you can have a headache, you can have people that are so ill and mean to you throughout a day, but then you can have somebody walk up and you can tell that they're upset and
they
worried
need
about
you.
what they're going through.
Right.
And you can talk to them about it.
Yeah.
And it makes them feel better.
Just your personal story.
yeah.
Yeah.
So
Or just listening to their personal
right,
story.
just listen to how they feel.
Exactly.
And you can understand, to a point what they're going through. So I think what I had to go through has I'm hopefully passed on, helping other people.
Sure.
Well,
Well, I know the oncology department here is wonderful.
Oh yes.
It
They
is.
have-
I remember
amazing.
one Easter Sunday morning, I had to get a Neulasta shot, and you have to
hated
get
them
those. And I thought surely they're not going to come in on Easter Sunday morning. Well, sure enough, they did. It was either Mary or Wanda. I think it was Mary.
Yeah.
Coming in Easter Sunday morning just to give me what I needed.
That shot to boost
Yeah.
boost you back
Yeah,
up. Yeah.
exactly. So
Yeah.
they deserve a gold star.
They do. They're amazing at what they do.
You really see a lot of good when you have cancer. You
You
see how
do.
many people, and you're at everybody's mercy. I mean, going
You're
in for,
right.
you realize how you feel, like you can do everything on your own, and when that hits you, then you really can't.
Yeah.
So you depend on other people so much, and you appreciate it so much. Cancer isn't a death sentence anymore.
No, it's not.
It really isn't, and that's behind me. And every day, I feel good. The quality of your life can be good. After you get through the bad part, and then you can have the good quality again. And that's what I hope for everybody. And I hope that they can find a cure So people just won't have to go through all these things. That,
Yeah, that we've had to endure.
Might come, right?
Right. That's
Yes,
what I was
it
telling
will.
you. It's uphill from here. It's
will.
going to get better.
Yep,
Yeah,
it'll be
it sure
back.
is.
It will be
You'll
back
feel-
in your
you'll
hair.
You'll be
feel
running around like the Energizer Bunny again. You should see her. She's in and out and down
I know,
halls and
she's-
back and forth.
Active person.
Yeah,
That's
she
right.
is.
It'll be back.
We're back.
Yep.
I'm looking forward to that. And my hair coming back.
And that will come
Yeah,
back.
it
Trust
will.
me.
Won't be long.
It does. Well, I think one of the most important things is to get a yearly mammogram, and then self-examination as well. You know, in the shower, that's probably the best spot to do that. I found mine, and I'm sure they would have found it 10 days later when I had my mammogram, but I did find mine. But just that yearly mammogram is so important because, you know, if they find it in January, they can take care of it. Whereas if you let it go 2 or 3 years, it is going to grow. And so, you know, when they find it small, they can take care of that. So early detection. Don't be afraid of a mammogram. It's just 4 short pictures.
Right.
That's all it is.
Like, a mammogram's painful. I don't want to have a mammogram. It's painful. No, it's not. It's nowhere near as painful
Yeah.
as having a breast removed
And having
or
cancer.
going through
And having cancer,
the
going through
diagnosis
chemo.
of cancer and all that chemo sickness.
Right.
It's as bad as they
Just
say.
4 short pictures.
Yeah.
And
yeah,
if you don't do it for yourself, do it for the people that
family.
love
Your
you,
family,
your
yeah.
family,
Absolutely.
your children, your moms and dads, everybody that
Yeah.
cares about you.
There's no excuse for not getting
No.
an annual screening mammogram. And if you're called back for extra pictures, that's all it is. It is extra pictures.
Right,
It's
right.
just a couple extra pictures. And it's not anything to be worried about because, you know, all of our radiologists, wherever they are, they're very diligent and they're very comprehensive. They want to see everything. And if they see one little shadow that might not have been there last year, they want to take a look at it. They want to take a closer look at it. So that's all that means is that they just want a couple extra pictures. So don't be worried.
And people think it's a money racket. I've heard people say, "Oh, it's a money racket," you know, to have to come back
you have to come
and
back
get these
for
extra
a-
pictures. Well, no,
It might save your life.
It isn't.
Yeah.
Yeah, it might save your life.
Every year, you know, the Commons Foundation, we gave so much money. I mean, we have a Commons hotline that you call into, and then Regina will screen you, and Amanda will see, you know, what your needs are. And most ladies that's unemployed, and if they qualify, you know, they can get a free mammogram. And then there's also, you know, we have here at the hospital the charity program.
Right.
And, you know, that would help you. And then, and, you know, also, if you have your mammogram and, you know, you want to pay for it, they have Access One here at the hospital. You make monthly payments. I mean, it's a lot better to do something like that than let it go.
I think they think that they're too busy and that they're afraid.
Well, just like Debbie said, not me. You know, I work in healthcare,
yeah.
not me.
Yeah.
So possibly.
Well, I went a year and missed the mammogram, and I schedule mammograms every day. I didn't even schedule myself one. And I just think, like you said, a lot of people say they're too busy. And I found out when I was in the hospital and had my mastectomy, I was talking to the ladies coming in and out, and they said they were scared to have their mammogram. And I said, you should be more scared of cancer than your mammogram. You know, we have excellent techs and doctors and radiologists and oncologists and pathologists. They're all here for you. And you shouldn't be scared. And I even offered this one lady, I said, I'll go there and hold your hand for you. and you know, I would do that for somebody.
But you know, they're scared of cancer maybe, but they ought to be more scared of not finding the cancer. So,
Well,
you know,
that's right.
at any time you have it, that's the best time to have it because tomorrow would be later and the next day would be later. So if you haven't had one in 3 years, don't be embarrassed. Call us. We'll schedule one for you. You know, late's better than never.
That's right.
The oncology department here at Grace, and then the Valdez Cancer Center. I mean, like Mary Wise and Wanda Mace,
yes.
they've been here forever.
Yes.
And they are just wonderful ladies. And they're all, Dr. McDonald, all the doctors, and they're just so caring, and they listen to you. And I mean, even like the pathologist here, I mean, they're the one that had diagnosed you and, you know, helped, and our radiologist, but and just the little girls that take your blood pressure and your the CNAs. I mean, you can tell they're caring.
Right.
They, you know.
And
you see them at the hall, they ask about you.
That working in scheduling, we can hear in a woman's voice whenever she calls in and she's anxious and worried. And so we try to get them in more quickly so that they can get on the road. And, you know, if there's a diagnosis there, they can get on with their treatment. So I think everybody from, you know, the front desk to scheduling to the wonderful technologist to the physicians, the radiologist, and then later on to the oncologist and surgeons, just can't say enough about them. Very empathetic, just willing to be there, listen to you, and take care of you.
Yeah.
Yes, the radiologists were fantastic for me. I mean, you know, in explaining everything, and they cared, you know, about you as, and in keeping your appointments. You know, like you have to follow up at 6 months, and that's very important too, because on the mammograms they look for changes, and sometimes, you know, when we're doing mammograms, we'll see a lady will have a 6-month appointment, and a whole year has gone by, and she's back, and it's time for the yearly mammogram instead of the 6-month. So people should try to do what the doctor tells them to do as far as keeping their appointments on certain schedules, because they are looking for changes in breast tissue.
Definitely. My faith, I was raised in a Christian home. You get into your teens and you think, well, you know, I'm beyond all this. I can do anything. You know, you think you're invincible. And then you get a little bit older and you still like, you know, go to church sporadically. But when you face cancer, you know that you've got to have some faith to rely on, or you can't get through it. There has to be a reason. I mean, I really feel like the Lord sent me a message. You need to get involved heavily in church. You need to be showing and sharing what you've gone through now with other people, because it could save somebody's life. And I mean, I honestly believe that's my testimony. I'm like, I believe that He sent me a message loud and clear. I had was diagnosed with osteoarthritis, about 3 years before I was diagnosed with cancer, and it was so painful. I had no idea arthritis was that bad. Went through, you know, rheumatologists, good doctors, got me on some medicine, so I got to feeling better from that. And then I still wasn't doing all I should. Well, when I got cancer, hey, I ran to church. And I thank the Lord every day for me still having a life, and for my family and all the blessings I've been given. And He helped me get through it, and I would try to do the best I could. And I'm really involved now, and it's faith. I mean, it really, my faith, I think, got me through.
I turned it all over to God,
yeah.
Every bit of it. I couldn't, you know, if something's too great for you to deal with, God can always deal with it.
Yeah.
So every bit of mine, I turned over to Him. I said, you take this, and He took it all.
Yeah.
And that got me through it.
After my chemo on Fridays, I mean on Sundays, I had to go every Sunday to have my shot.
Right.
Well, I mean, I've always been in church every time, you know, Sunday morning, because I've helped a lot of church, and you know, it killed me to have to miss church every other Sunday, you know, to go have his shot. But you know, I just wasn't able afterwards. But I have a wonderful church family, and I think more people knows, more prayers will go up for you.
Yeah, they support you.
Yeah.
And I work with you know, our work family here. We're good Christian girls, all of us are, and everybody prays for you, and you need them prayers.
That's right.
Yeah.
That's right.
Yeah.
That's right.
Yeah.
I agree with Susan. I just turned it over and said,
Yeah.
The girls at Blue Ridge Radiology were so good to me during that time, and I don't know what I would have done without them.
if there's anyone out there that has questions, they
Yeah.
can come to me anytime. I'll be glad to answer
Yeah,
any question for
absolutely.
anybody. I'm at the front window. You come in the front lobby of Grace Hospital, I'm at that front window. You come right on up and talk to me. I'll be glad to answer your questions. I think a lot of times that stops people from having their checkups or getting the help that they need. They just are afraid, or they don't know what to say or who to ask. But I've always felt, I told them, like I told Debbie, I said, anything you need to know, want to know, I'll be glad to help you with. And she was like, I don't know what's coming. And so I even showed her my scars. I'm like, you know,
She
hey.
took my daughter and me back in the storeroom.
We went in a back room.
It makes a difference.
Yeah, I'm like, it's
Yeah.
fine. You know,
Yeah.
My daughter was so scared to her. She's 23, but just
Yeah.
and we're real close. And she took me and Brittany back in the storeroom and showed us and talked to us. And oh gosh, makes us
Well,
feel so much
breast is
better.
a large part of being
Yeah,
a woman.
yeah.
I mean, that's a big part of being. And my first thought was, I don't want to lose a breast. That's, you know, one of the calling cards of being a woman. But between that and life and seeing my children graduate high school and my son's getting ready to go to college, and I'm like,
We
it
would've
was
missed a
nothing.
lot.
Yeah,
We would've missed a lot.
losing that breast was nothing,
Nothing, right.
compared to
That's
all
right.
this life and joy that I've had since.
Yeah.
So, yeah, if you need support, if you need answers, ask somebody. There'll be somebody around you that can help
Absolutely.
you.
You know, someone's always experienced it before you, and
Right.
Or experienced it differently.
Yeah.
You know,
Yeah.
Susan had a different type of surgery
Right.
than I had, and
Yeah.
you know, and so if you know that somebody has had what I've had, you know, please feel free to
That's
push
right.
them my way. Yeah.
I've talked to a lot of people. They call me at home.
Yeah.
They come by. They call me at work, and I really feel like, you know, if I can help somebody, I'd be more than happy to discuss. You know.
Right.